Hi, my name is Vanessa Lech, and today's video slash podcast is definitely impromptu, and it's going to be on a new community care Veterans Health Administration survey that I just discovered this evening. It popped up in my email box, and I figure if I waited till my hair was all pretty and I wasn't in my workout clothes, then it would probably never get done. So I'm just gonna go ahead and do it now. So for those of you that don't know, the U.S. Department of Veterans Affairs is broken into three branches. It may be more now, I don't know. But last I knew, it was Veterans Benefits Administration, Veterans Health Administration, VBA, VHA, and the Cemetery Division. So no particular order. They now have other branches, which I'm actually going to get to right now, called Veterans Experience Office, which is exactly where I think yes, right here. It says Veterans Experience Office. So I don't know if they're considered another branch of the Department of Veterans Affairs or not. I'm really confused about that. The U.S. Department of Veterans Affairs has gotten much bigger over the last number of years. And this is in large part because of all the negative publicity, and rightfully so, about all their myriad of problems they have at the organization, which is true. They have tons and tons and tons of issues. And so I don't know if they're their own branch. I know they're their own department, that's for sure. And they have their own call center. I've covered that extensively in different videos slash podcasts about the White House hotline. Okay. So anyways, I'm going to get to it. So today I got this survey in the mail, email. Really quick, easy survey. Only took me a few minutes. It says right here, 4-minute survey. This is really typical of the surveys that Veterans Affairs have been sending out. Typically, I only see ones coming from VBA, Veterans Benefits Administration. When I call in there, they frequently will send me surveys, which is great. I support anything that will improve the organization. Veterans Health Administration typically never, ever, ever sends me a survey. And if they did, I would light them up because I'm really unhappy with Veterans Health Administration, which you would know if you watch my videos. I've had a lot of problems with Veterans Health Administration over the last 10 years. Okay, so I clicked on this, and then I'm going to go ahead and get to the next screen. Okay, so some of this is going to share some of my personal information, which I wasn't planning on, but whatever, it just is the way it's going to be, I suppose. Okay, so it has these questions, and basically anywhere the person is seen is going to be filled in right here. And it's like the questions are, I was sat for those of you that are listening or can't read this because part of it's blocked anyways. I was satisfied with the amount of time I waited between scheduling and being seen by, and then it lists the place like that you went to or whatever. And I didn't waste my time with blocking this information out just because, I mean, I literally just don't have time to be doing all that. It's just a lot. The next question is, I knew what to expect during my appointment with Chris with the place that you would have been seen. Okay, so then the rating is strongly disagree is 1, disagree 2, neither agree nor disagree 3, agree 4, or strongly agree 5. That's a scale for every single question here. All right, I had no difficulties traveling to my last VA community care appointment. So, I answered all these questions honestly. Obviously, it's going to vary from person to person. My issues really have not really been typically, there are exceptions, okay, are not with the customer service, let's just say, or whatever, or patient experience in the community. It's with Veterans Health Administration. And honestly, it's just trying to even get the most basic of healthcare because it's just such a mess at Veterans Health Administration from what I've experienced. And the customer service tends to be so poor. There are people that are there that are great, but a lot of them are just like shouldn't be working there. Bottom line. All right, so I'm going to share the next screen, and it has the other questions on there. Okay. So VA community providers are well versed in how to properly treat and care for veterans. The same skill as I mentioned before. I am confident that my VA health information was provided to wherever the person went. to ensure I receive quality care. I'm satisfied with the care received from wherever the person went. Same rating skill as well. I trust VA community care to address my medical needs. I really do. I really don't trust Veterans Health Administration to address my medical needs, and I'll get into that in a second. Can VA contact you about your feedback? It's like, yes, no. And then would you like to volunteer your demographic information? Da da da. And then that's it. And I'll share the final screen. But basically, there it is. That's it. That's the final screen. So it was a super short survey, which is the best kind of survey, is a super short one, in my opinion. But my experience has basically been time and again that I have to advocate for myself at the U.S. Department of Veterans Affairs because no one's going to do it for me. Specifically, I've noticed this being the trend at Veterans Health Administration. Okay. And, my experience has also been that there's a lot of apathy and aloofness with some of the people at work at Veterans Health Administration regarding not really being detached from like the fact that you're supposed to be there to help accomplish a certain goal, essentially. And that goal, some of the people I was interfacing with was helping military people that are eligible, like military veterans, obtain the healthcare services that they need, essentially. Not just there to pick up your paycheck and go home and spend time with, people in your life. And that concept seems to be lost on a good many of the people that work there. And it's a serious issue because this organization costs a lot of money and that money needs to be well utilized. And I know that there are many people that work there actually severely underpaid, specifically healthcare providers. I've noticed a number of them, not all, but a number. I know because I used to work there a number of years ago. Can relate to that. And then you have people like the pay is just an issue, like overpay some people in some admin positions, severely overpay, and then severely underpay others. And then there's just a lot of like bad stuff that goes on with people being promoted because they're in good and friends with so and so, or they've done dirty things with such and such management. There's just a lot of corruption at Veterans Health Administration and like illegal activity, throughout the organization. And this is very well researched and documented in the news media too. And it really only hurts the people eligible for healthcare services and the people that work there that are trying to do a good job by the military community. That's what hurts. And of course, the taxpayers as well, that are getting the most bang for their buck. So anyways, let me know if you've received one of these surveys, if you fill them out, what your thoughts are on the U.S. Department of Veterans Affairs utilizing surveys. I personally love them. I think anything to improve the organization is completely great and fine with me. I love the fact that they're pretty short. This one was the shortest one I've ever seen from the VA. But just know any comments or audio message you leave for the podcast will be public for all to see potentially, specifically the comments. But even the audio could be used in a future video/podcast episode. Okay, so I wish you all the best. I hope you have a happy Thanksgiving. Do not forget that there is a new store called store.hellovanessamedia.com. And there are a few different ways you can support the content now. You can go to hellovanessamedia.com. There's a support button. It'll tell you all the ways. You can check the description down below this video or a podcast if you're listening, and it will have the links of where you can go. So pretty excited about that. Check it out if you want to keep this content coming, because it does take time and money, resources to bring you this information. Like everything costs money, to include even the software that I'm using to make this a reality. Okay, but I hope you have a happy Thanksgiving, and I wish you all the best. Bye.